Preview.
Hi everyone, welcome to my channel once again. This is Gina Chimesi. As always, on this channel I talk about mental health issues as well as self-help and mental health education topics. Today we have a special guest. I'm super duper excited and I'll introduce him shortly. But have you ever, or you yourself or any other family member, be told that you snore while you're sleeping? Have you ever had a partner not want to share a bed with you because you were told you snore? I know this topic can be very touchy. I know sometimes you can get defensive about it, but today we are here to get to the bottom of it so we can find some solutions. Because sometimes, like I always said, if you whip it in your mind, you can whip it everywhere else, including your sleep. Now, sleep apnea, from my research, can come in a variety of spectrum. You know, mothers, while we're pregnant, sometimes we can experience that because of some weight gain issues and things like that after birth. Also, you know, women and men as we get older, through our midlife and older ages, as we sometimes tend to retain weight and things like that, we can have trouble with sleep. And many of at times it's not just related to stress or work stress and things like that, or environmental stress. It can be purely medical. And one of the big culprits many a times is sleep apnea. Now, in this world, actually, from my research, over 8 million people are diagnosed with sleep apnea. And some of the treatment modalities out there these days typically don't seem to work. People are not compliant. I have many clients who are super duper in a place of struggle with this issue. So today, here to highlight on this issue and give us some answers and some explanation and demystify the subject is none other than my brother, my friend, my colleague as well, highly respected Dr. Adekolu. He's a physician at Sterling Physicians. That's the umbrella name for his company. He's a pulmonary critical care and sleep specialist. I hope I got it right, Dr. Adekolu. Thank you so much. I appreciate your time and your nuggets that you're going to share with our audience today. And I salute you for being able to make that time for us this morning. Thank you so much.
Absolutely. Thank you so much for the introduction.
Absolutely.
Yeah. So yeah, you know, it's exciting. You mentioned something very critical. You know, in your introduction, you mentioned the fact that over 8 million people worldwide, you know, do suffer from obstructive sleep apnea, and that's very critical statistics. You know, so. In fact, when we look at the population of people who are affected with sleep apnea in the United States alone, if we come closer to home in the US, up to 10% of adults in the US do have obstructive sleep apnea. And it's even worse in children. In our children, there's a large population of kids who suffer from sleep apnea. And that manifests specifically in behavior, in the ability to perform at school and perform in the academics. So this is a very critical topic that I think needs to be talked about.
Right.
Also when we even narrow down to a population like the African American population, looking at the African Americans specifically, we're even more affected than other races with respect to sleep apnea.
Right.
If you're an African American above the age of 65, you're
Right.
twice as likely to have sleep apnea when compared to, to a Caucasian or some other race.
Right.
So this
Sure.
is a very critical topic for us to, really delve into and understand.
I understand, of course. And it is so important that you highlight the children, because I'm gonna have Dr. Evelyn join us. Maybe she might have one or two nuggets to add to us.
Absolutely.
Hi. I don't know if she can hear us. Okay. Can you
Hold
hear?
on one second.
Okay.
Hello, good morning.
Hi, morning. How are you?
Good, how are you? How you
Yeah,
doing,
pleasure
Sister
to join
Gina?
us.
Yeah, of course, of course.
Yeah. So we were talking about children. I was speaking of Europe and mentioned that I remember because my daughter was born a little early, and she had some trouble with breathing and things like that. And come to find out, she had swollen adenoids, as well as what was the other thing? Something else.
Probably
And
an enlarged tonsils also,
and
probably.
tonsils. Thankfully, in her case, it was just adenoid. It wasn't tonsils. But I know the pulmonary doctor at that time had mentioned there are kids who also have issues with their tonsils.
Yeah.
So, I mean, for almost a year, we struggled. She couldn't sleep. She'd be restless. She'd be snoring, which is one of the, and we said, hey, to grow out of it. We'll try prednisone, which, prednisone really is not something we should be playing with too much. But when she did that, it was just a minor outpatient procedure. They took out her adenoid. It was night and day. So I want to highlight it for anybody out there who has a child, because it wasn't on my list, but I was so glad you brought that up, because I have so many mothers who are struggling, and kids keep having respiratory issues because they might have swollen adenoid or tonsils. So thank you for bringing that up.
Yeah.
Absolutely.
So yeah, so if you can highlight a little bit on what is apnea, how does it, some of the symptoms that we need to look out for.
Yes. So, delving a little bit deeper into what sleep apnea is all about. So when we look at sleep apnea, there's an umbrella. The term sleep apnea is an umbrella term. So it encompasses the different types of sleep apnea. But specifically, I think what we should focus on today is the more common type, which is obstructive sleep apnea. So obstructive sleep apnea in itself, it's mechanical in terms of what causes it, the pathophysiology.
Right.
I wanted to highlight on that by actually sharing my screen.
Sure.
So that we can just have a better understanding of what's involved.
Some of us, we learn by visual, so that would be very helpful.
I think that's easier to learn from. So if you can see my screen, so this is a pictorial representation of the upper part of the airway, just leading from the mouth into the back of the mouth, also known as the oropharynx, which is this area. And what you can see here is the tongue lies basically within this small space. It's a pretty small space, within the mouth. Now, one of the things we've noticed is some people do have a tendency to have large tongues, which specifically would have to fit within this small space. The other thing is sometimes when we gain weight, part of the places where we gain weight is in our tongue. We have some deposition of fat tissues in our tongue, which specifically can also increase the size of the tongue within this limited cavity. So what happens in obstructive sleep apnea? When we go to sleep, what happens is the tongue falls backwards. The tissues at the back of the mouth, they also fall backwards, and they cause an obstruction to the flow of air, right? So basically what's happening while we sleep at night is there is an obstruction to the movement of air. And a lot of people will wake up in the middle of the night because they have this feeling that I can't breathe. There's something happening. So they wake up choking or gasping for air. Sometimes you may not even feel the symptoms. You may just wake up multiple times in the middle of the night and you're like, why am I waking up? I don't know. I just can't sleep through the night, right? For other people, they wake up in the middle of the night because they need to use the restroom.
Right.
Yes, and they do that multiple times. It's unusual for an adult to have to wake up in the middle of the night to use the restroom. So it usually indicates there's something else going on. And that's one of the manifestations of obstructive sleep apnea. So sleep apnea can definitely also manifest in that manner. So, you know, the question is, with sleep apnea, how do people present? What do they present with?
Right.
Snoring is one of the major ways in which people present. You know, you snore. Now, the fact that you snore does not necessarily mean you have sleep apnea, but most people who have sleep apnea do snore. I did mention the gasping and choking awakenings in the middle of the night. Sometimes your partner would say, oh, I noticed you snoring. I noticed that you actually stop breathing in the middle of the night. That's one of the main signs, right, of sleep apnea. People wake up with a dry mouth in the mornings. Sometimes people have headaches. You've slept 7-8 hours, you spent that amount of time in bed, yet you feel very unrefreshed. When you wake up, you feel like you need more sleep. And then during the day, you fall asleep all the time. You're at work, you're less busy, and you're not enough. You are at home, on the dinner table with your family, you're not enough. You sit down to watch TV, you're not enough, and you feel tired all day long. So these are all cardinal signs and symptoms of sleep apnea. The other big thing is there's this lack of energy and inability to focus and concentrate and get your job done. That makes you very, unproductive. You're not as productive as you should. So these are all different ways in which sleep apnea can manifest. And these are things that people should look out for. Don't just assume, I'm just having these things. You have to, figure out, look at these things. If you're having this symptoms, talk to a medical professional, talk to someone who can kind of guide you on the next steps.
Right. That's so interesting that you mentioned that too, because many of my clients / patients will complain of some of the symptoms you just described, like especially the daytime sleepiness. I'm tired. I feel like my meds for my mental health are not working. Or like you said, the fogginess in the mind and not able to concentrate or focus. And guess what they want? They will be, focusing on, I feel like I have ADHD. I'm tired. I have low energy, low motivation. I can't concentrate. I can't focus. And they want something to counter that. And guess what? We're leaning towards a stimulant. So this is so important right now to be able to decipher between what is happening at nighttime and how is it showing up during the day in that particular person. So going forward, jumping off of that segue into what can we do about it? Is there any treatment? I was looking it up and before I even say I'm looking it up, for so many years, I work in ICU and night shift, which kind of showed me, people, patients sleep at night and you have an easy shift. No, a lot of patients don't sleep at night. They're up, they're not sleeping, they can't sleep. Now, majority of the patients in the ICU might have, a lot of respiratory issues. They're on the CPAP, BiPAP, they are on the ventilator. When they come off, it's all the spew and revolving door. So the ones on the CPAP machines, guess what? They're not wearing it. They, like I mentioned in the introduction, they'll take it off. They'll say it's uncomfortable, it's too loud. And when I was researching, making some of my notes here, I found that there's a new thing called mandibular advanced devices. And it's just kind of like mouthpieces. And I also found out that they actually think, instead of the CPAP Max, there are some that are like nasal cannulas but I really hasn't seen it much. So can you highlight a little bit, the CPAP? I know many clients of mine though are, let's say, have Husky or Medicaid, and some of them might have commercial insurance as well. How, talking about those options besides CPAP, and then let's also consider affordability. Are they affordable? Are there anything over the counter that people can try? Are there any testing? Maybe if they don't want to go into the hospital for a day, let's say a mother who have kids, you don't have a babysitter to go and do a sleep study overnight in the hospital. Are there any options like at home where somebody can be monitored while they're sleeping in the comfort of their home and being monitored remotely? Are there any options like that these days? If you can highlight of that, please. My people are listening, and I know we can all benefit from this today.
Yeah, absolutely, absolutely. So I'm going to start with sleep testing,
Right.
and then we can delve a little bit into how we treat. So with regards to testing, traditionally, the way testing was done in the past was specifically in the sleep lab. So basically that involves, having that individual go into a lab where they sleep overnight, and they get tested. And, for a lot of people, like you said, it's difficult to do that, just the logistics of having that happen.
Right. Yeah.
More recently, and I wouldn't say, it's been around for the past, I would say 7-8 years. We now have the capability of doing home sleep testing. Yeah. So what does home sleep testing involve? Usually it involves you picking up a device. So you either pick up the device. Nowadays, it can also be mailed to you at home. And it's usually straightforward. It's a little band, like a belt, one over the chest and one over the torso, and just something to kind of measure the flow of oxygen. And it's usually, it's a 1-night study, sometimes 2-night study. It's done overnight, and then you bring the device back, to the sleep center, and then they can download the data and then interpret the data. So we do have the capability of doing that. Now, the caveat to that, though, is that these devices, they are not foolproof, meaning that sometimes they can tell you that sleep apnea is not present when sleep apnea is truly present. Right. So there are situations where we send you for this test and it comes back negative, and we say, even though the test is negative, we still think that you may have sleep apnea just based on, everything we found that, and you need to do a study in the lab. So that takes a little bit of, expertise in looking at those details. Right. So that option is available. Now, in terms of treatment, I would say that the CPAP machine, it's been around since as far back as 1981, the 80s. It's the best type of treatment we have out there, and it's the most effective treatment. However, there are options. Now, one of the options that you mentioned earlier is an oral appliance therapy. Okay. And I will also go ahead and share my screen. Okay, awesome. So that people can kind of have a feel of what I'm talking about here. Right. So if you can see my screen. Yes. So these are all appliance devices. So specifically, these devices are made by sleep dentists. Not all dentists can do this. Okay. They have to be specifically sleep trained, because what they do is they try to fabricate these devices, right? Now, the way this device works is it fits into your upper and lower jaw. And the idea is to pull forward the lower jaw and open up the back of the throat.
Wow.
Yeah, so that's how that device works. So those are called oral appliance therapies. Okay. The other thing that's kind of
Can
in
I
the
see that
market.
again? I was just making a note.
You want to go back? You want to go back to
please.
that?
Yeah, right.
Just give me a minute. I would pull that up for you.
I just wanted to see. That's very interesting. I've never heard of. They all almost look like braces.
Yeah.
Mm-hmm.
Just a moment. A little bit of technical.
Oh, that's okay. That's okay. Let's move forward. I'll look at it later in the recording.
Yeah, just a minute. Just a minute. I'll pull that up for you. All right, let's go back to that. Share the screen. All right, I think I have it up for you now.
Okay.
Oh, did we get to it? No.
That's my bad, being nosy. That's right.
Yeah.
I'll look at it later.
Yeah. So anyway, those are your oral appliance therapies, and basically what they do is they pull forward the back of the throat.
Right.
I mean the mandible, and then increase the space at the back of the throat.
Right.
That's how they work.
Right,
now
right.
the other therapy I wanted to talk about was the Inspire therapy.
Mm-hmm.
A lot of people would have seen this. There's a lot of advertisement about this on TV. Mm-hmm. And basically the way this works is it's an implanted device. So it's something implanted underneath the skin. And the idea is it moves forward the tongue, and by doing that, it increases the space at the back of the throat.
Oh, wow.
So it's an interesting, I'm sharing the screen now so you can see what I'm talking about. Okay. Yeah, so you can see here that it's a device, it's implanted usually on the chest wall. Right. And then they kind of send leads that go to the tongue and innervates the tongue and then moves the tongue forward while you're sleeping at night. Mm-hmm. It's an invasive procedure because this has to be done, in an oral setting. It's usually done by ENT specialist, right. But it's something available out there. If you have sleep apnea, you're not doing well on CPAP therapy, you should talk to your sleep specialist to see if this is something that you can try. So yeah, so this is something available out there for people to try, and this is just a picture of how it works, opening up the airway. Now there are also surgical options. There are surgical options. There are people who prefer, they want to get a procedure done and forget about it, right? So there are surgical options. Occasionally, when we see clients in the clinic and we look at the upper part of your throat, we look at your mouth, and if we feel like there is a lot of soft tissue there that something can be done about, we can have you go see a surgeon. And what they do now, this procedure is called the uvulo-pharyngopalatoplasty. And basically what they do is they cut the uvula and increase the space at the back of the throat. Wow. And by doing that, they can reduce snoring and also reduce the severity of sleep apnea. Wow. Okay. Another available option, takes a little bit more process, is the maxillomandibular advancement surgery, or the MMA. This is a little bit more because what happens is they're making incisions in the upper and the lower jaw.
Right.
And the idea is they're trying to move the jaw forward. So they make those incisions, they put some implants, they move the jaw forward, and by doing that, they increase the space at the back of the nose.
Wow.
Yeah. So so there are options, out there for sleep apnea. It's not just CPAP.
Not just
Sure. There are definitely options out there.
right. And I saw the other picture you showed. The mask was just over the nose. It wasn't
Yes.
Almost.
Yes, that's correct. Yes. And yeah, even when we talk about the good old CPAP,
right,
we do have several options. There are masks that cover the nose and the face, which is the traditional ones.
right.
But we also have masks that just covers the nose. We have nasal pillows, almost like an oxygen nasal cannula that just sits underneath the nose. So the comfort from the use of the CPAP mask, it's been better over the years. The machines are better. They are more quiet, more comfortable. So we do have options. We do have options.
Now, in regards to comfort versus patient affordability, what have you seen so far?
Yeah.
Do patients have the option to say, this one is not comfortable, maybe the mask is too big, can I switch it, or do they have to consider their pockets at that time?
So absolutely, you can switch it. For the most part, the CPAP machines are covered by Medicare and Medicaid.
Right.
And even the private insurances, they cover the CPAP machines. And usually the way this works is a medical equipment company provides you with this equipment.
Oh, right.
And as part of that provision, you're able to switch your mask over. It's within a specific duration. I think every 3 months. You can ask for a different mask. You can ask for something different. You can try something different. Sometimes we do what is called a mask fitting, whereby we have the client come into the office. We try different types of masks to see what fits them and gives them the most comfort, and then they go with that mask.
Right.
Yeah. So there are resources out there with respect to this.
Right. You just have to speak up. You just have to.
That's correct.
So if you're listening today, because I've heard that over and over, many people will rather say, hey, my sleep is really awful. Give me more meds. I'm on Ambien, I'm on Trazodone, I'm on hydroxyzine or melatonin, name it. Sometimes you have the combination of this and that. And that's why I really want to highlight that if you're listening, if you continue, even when you're on sleep meds and you continue to have trouble with sleep, it will be good idea as if you're listening today, just get tested. Like we were talking before, Dr. Adekolu, you mentioned what typically will be the starting point to get to someone like you who is a specialist? Where do people start? I know a lot of people come to me as a psychiatric provider. I usually will recommend that they go back to their primary care to start the problem. What have you seen? What would you advise?
So, we get referrals from usually from the primary care physicians, but we can get referrals from anywhere. Specifically, if you have a client who snores at night, who has frequent awakenings at night, who feels tired during the day, feels sleepy during the day, if they feel like their sleep is not refreshing enough, that should ring the bell, and sleep apnea is a likelihood, and that should automatically trigger a referral to us. So we accept referrals, from all around. It's mostly primary care physicians, but that doesn't mean if a referral comes from your office, we're not going to accept it.
Right. Okay. Gotcha.
Yeah. So absolutely. I think the big part of this is just making the community more aware that this is something. One important data that I forgot to mention at the beginning is most people who walk in to see us as sleep specialists, they probably had sleep apnea for close to 10, 15 years.
Wow. Wow.
Before they finally decide that the symptoms are becoming debilitating and I need to go see someone. Yeah, so that's just to give you an idea of the fact that there are so many people with sleep apnea, living with sleep apnea, who are just dealing with it and not having it, you know, managed by an expert.
Right.
You know, yeah. So there is a solution. I mean, there are many conditions that don't have, you know, a form of treatment. Sleep apnea does.
That's
You know, it's something that can be treated. It's something that can be managed. You know, so we should make more people aware of that.
Right. Now, if sleep apnea does go, especially like you mentioned, obstructive sleep apnea does go for a long time untreated, at least from my standpoint, working in the ICU over time, doesn't that have a correlation to sometimes having some heart troubles, including enlargement of hearts? Sometimes I try to use that as a, you know, I have heard some of the pulmonary providers back then when I was working inpatient use this as a caution. What would you say? What have you seen too concerning that? I feel like it can have a detrimental effect on other aspects of the person's health if the treatment is not done as soon as possible.
Absolutely, you're right on that. Listen, sleep apnea has been known. We've had so many studies. We have the data that has shown a very strong relationship and association between sleep apnea and cardiovascular diseases. So when I use the term cardiovascular diseases, I mean conditions like high blood pressure, heart disease, heart attack, strokes, mini strokes, diabetes. All of these terrible conditions, they all do have an association with sleep apnea. And one of the reasons why this association exists is with sleep apnea, there's a deprivation of oxygen. So each time people stop breathing in the middle of the night, the oxygen level declines. And when that keeps happening over time, it's a breeding ground for this other medical conditions to begin to rear their heads. So there is that huge association between sleep apnea and these metabolic conditions. But even apart from that, how about the socioeconomic effects of sleep apnea? People getting unproductive. How about the risk, accidents related to sleep apnea? So we have all of these major factors related to sleep apnea.
I mean, I had this incident the last time, actually, not to mention like last week or so. She's one of my clients, you know, because of HIPAA, not disclosing much at all, but I wanted to use an example of that when you mentioned the safety concerns. She was driving and literally she would just lose control of herself. Like she just can't control. She'll fall asleep and she'll pull off to the side of the road. She might want to take a cat nap, but as soon as she gets on the road, she works, commute long distance from work, but she was so unsafe. And I said to her, no, you are putting yourself and other innocent people on the road in danger. So let's get this ball rolling. Let's get tested. And she came back. She was diagnosed with sleep apnea. She was just thinking she has daytime sleepiness. She was thinking her depression was getting worse. And that's why sometimes there's a big link also with sleep apnea, sleep troubles, with increased depression, increased anxiety, because of course, as you mentioned, as you're not getting treatment, you're piling up more troubles in regards to your health. You're not productive at work. You're not productive at home. You're tired all the time. Your depression, anxiety levels will be higher, not to mention other comorbid issues such as substance use, because now you feel like, hey, I got to use something to keep myself going. People will get into things like marijuana use because they feel like it might give them a boost of energy or numb them enough so they can function and work. So this is a very important and critical matter. And when things like that start happening, not only it's affecting the person, but in many cases, it's affecting the whole household.
That's right. That's right.
And I also mentioned, is this common in men more than women? Is it more common in men that are maybe transitioning to maybe midlife, that maybe are, because there's also this concern with men who might have, more guts, maybe might not exercise or eat too well. What is the correlation between the men diagnosis, percentage of that versus women and midlife?
It's interesting. You mentioned that it's absolutely more common in men than in women. It's actually twice as common in men. And I think one of the reasons has to do with where men kind of accumulate fat as they gain weight.
Wow.
I did mention earlier on that one of the things that happens in sleep apnea is the accumulation of fat around the neck and around the tongue, right? Also, accumulation of fat in the gut area, what that does is it increases the pressure on the lungs. And by increasing the pressure on the lungs, it makes it more difficult to breathe and increases the probability for sleep apnea and obstruction of the upper part of the airway.
Wow.
So absolutely, it's more common in men than in women. However, the interesting thing is this. Once women begin to approach the age of 60, 65, meaning once they begin to get postmenopausal, that risk kind of equalizes. So once women get, postmenopausal, the risk of sleep apnea equalizes that of men. It's interesting. So we've looked at studies and we're thinking maybe there might be a protective effect of estrogen, in younger women as opposed to older women. But it's interesting data. Yeah, very interesting data.
That's interesting. So when we were talking about managing men especially, and then women postmenopausal, as we have more risk, what are some of the recommendations? There was a documentary that I was watching actually on sleep apnea. I'm getting more obsessed with sleep apnea because I'm seeing such increase in, struggle with sleep issues and things like that. And one of the participants on there was getting a little, or was it participant, or more like, he or she was trying to ask a question. And the doctor who was answering did mention that many people who suffer from sleep apnea have weight issues, but he fired back. And when I say fire back, he fired back saying, this has not 100% anything to do with weight. Stop criticizing people with maybe obesity or weight issues, which, sometimes it can be genetics in some families that struggle. Every family has what they struggle with. In some families, it's weight, in some families, diabetes, hypertension, or a combination of it. But weight is a factor, correct? As you mentioned, the neck, the thickness of the neck, and all of that stuff causes the tongue also to have, some increase in length or weight, or however, you probably will put the best lingo to what I'm trying to say. But has weight got anything to do with it? And does losing weight solve this issue in some people?
Yeah, so absolutely, there is a relationship between weight and sleep apnea. And now, this is not to say that people who are not heavy cannot have sleep apnea.
Oh, yeah.
Yes, absolutely. There is some, I wouldn't call it a genetic component, but I would call it a familial component, meaning that members of the same family can all have sleep apnea. And, as I mentioned earlier on, sleep apnea is mechanical. So if you have an anatomy that increases your risk to sleep apnea, then the likelihood that members of that same family would have sleep apnea is higher, right? So you can definitely have sleep apnea without being overweight. However, the relationship between being overweight and having sleep apnea has been established. There's no doubt about that relationship. Increased weight, as I mentioned, increases the risk for sleep apnea. And we know that weight loss also reduces the risk for sleep apnea. In fact, like a 10 to 15% weight loss would reduce sleep apnea by 50% in people who have moderate obstructive sleep apnea. So one of the recommendations we make to our clients is weight loss, regular exercise, weight loss as much as you can. It might not totally eliminate all of your sleep apnea, but it's a good step to take, in combination with all the other forms of treatment.
Sure, right. I really like that. You mentioning, if you're listening out there, like Dr. Adekolu said, it's a good first step. You might still need to do other supportive stuff, but at least trying that and losing weight also can be effective in so many other aspects of life in general, including our physical and mental health overall. So I know he met the person who was saying, hey, I was going to a group for people who has diagnosis of sleep apnea, and a lot of people in the group that he was attending were not overweight. So that's what was his source of frustration when the provider mentioned kind of an umbrella term of, if you lose weight, then the problems are. How about the people who have no weight issues? Can be super frustrating to say, why do I struggle? And some people can have grief from that too, meaning that I don't have the typical presentation, but why am I still suffering? So in regards to people who are struggling out there, we highlighted many of the things that they can look for, many of where they can start from to get help. Of course, for me, like you said, I can straight refer to you, Sterling Physicians. Any other resources there that you can mention? I know this guy was talking about groups, which is the first time I ever heard of a sleep apnea group, a support group for people with sleep apnea. But, because this is how much people suffer, because when you are in that group, you feel like you're not alone. I don't want anybody out there feeling like they're alone. Definitely, this is so common, but don't hide. Don't be ashamed. And don't get frustrated at your partner either. You're nagging me. What are you talking about? I snore, so what? But if it's legit and you might need to get help, don't hesitate, make that first step, or make the step on behalf of that family member and make the call. Well, any other resources that you will be able to highlight to anybody listening in today?
Yeah, so absolutely. Definitely sleep apnea groups that you can be a part of. You can be part of a community. And that definitely helps, and helps with support. Even just Googling sleep apnea and looking at what sleep apnea entails could be very, very helpful. Like you mentioned earlier on, 22 million Americans have sleep apnea.
Right. Yeah.
That's a lot of people. So if you have sleep apnea, you're not alone. There's so many other people out there. Don't ever feel stigmatized because of it. There are a ton of people out there, and it's one of those conditions that can be managed. It can be managed. It can be treated. And I've had clients come to my office and they're like, oh my goodness, since we started managing the sleep apnea, it feels like night and day. I can spend more time with my family. I feel less irritable. Now I can listen to my family and listen to my children and sit down and watch TV, in the evenings with my family and not fall asleep. These are like very little things that, they actually make your life easy, and they're actually positive things. you
Right.
know. So yeah, so absolutely, if you do have sleep apnea out there, please do, you know, talk to your provider, you know, seek for help. The referral process is pretty straightforward and you know, pretty simple, and we have resources. We do have resources out there that can be very, very helpful.
Right. And with the kids, through their pediatrician.
That's correct. Yeah,
right?
with the kids through their pediatrician. A lot of times sleep apnea in kids, it's actually a little bit more treatable surgically, because you know, a lot of times in kids, it's, you know, it's an enlarged tonsils and enlarged adenoids, which can be surgically removed, and that would make a huge difference in the life of the kid. So yeah, so absolutely, you know, there is support, you know, look for that support, and you know, and enjoy your life.
Enjoy your life. I like that. Whip it in your mind, enjoy your life. Don't hide out. No shame to this. Many times you just start with a simple question. Thank you so much, Dr. Adekolu. Thank you, Mrs. Adekolu, for joining us and supporting us behind the scenes. And I don't know if you can hear me or anything like that, but it's been such a pleasure. I appreciate your time. I appreciate you guys so much. I hope that hopefully maybe sometime next year I can snatch one of you or the both of you at some point and maybe have something else to chat about and bring some answers to some questions that people might have. But yeah, I really appreciate you guys. And I'm trying to see if she said something. I couldn't see. Okay, yeah, she's saying welcome. Yeah, thank you. Have a good weekend.
Yeah, thank you. Absolutely. This is a topic I am absolutely passionate about. And yeah, so
I can't wait to spread the word. I can't wait to spread the word. This is much needed. And I called you right at the time as we transition to late fall and winter. More people have issues with sleep even more than now. So I will share with my clients, my patients, so they can get some answers and look for help. And not the answers is, I want to mention that the answer is not always just medication based. There are so many other support, just like you highlighted, to get some better sleep, for sure. Thank you so much. And
thank you.
Oh, you're welcome, Dr. Evelyn.
And for inviting us.
Yes, absolutely. My pleasure. Spending your early morning, beautiful fall, or almost fall Saturday with me. I appreciate you guys so much.
Yes, continue the great work. You're doing great work. Continue the great work.
Thank you for sure. So we'll be in touch. You guys have a great weekend and take care, be blessed.